Do you hear ringing, buzzing, or hissing in your ears even when everything around you is silent? It's a phantom sound that no one else can hear, a private symphony that can feel incredibly isolating. If you experience this, you're far from alone. Over 700 million people worldwide live with this mysterious condition called tinnitus. But what exactly is it? Tinnitus isn't a disease itself, but rather a symptom of an underlying issue. The sound you hear isn't real. It's your brain generating a perception of sound in the absence of an external source. This often happens when the brain tries to compensate for a loss of input from the ear, creating its own noise to fill the void. The causes are varied. The most common trigger is exposure to loud noise, which can damage the delicate hair cells in your inner ear. This could be from a single explosive event, or from prolonged exposure in a noisy environment. Other causes include age-related hearing loss, ear infections, or even a simple buildup of earwax that blocks the ear canal. In some cases, it can be linked to medical conditions like high blood pressure, TMJ disorders, or as a side effect of certain medications. The impact can be profound, affecting concentration, causing anxiety, and making sleep feel like an impossible goal. But here is the crucial message we want you to hear. While there is no universal cure for tinnitus, there is a wealth of effective strategies to manage it and reclaim your peace. Let's explore the pathways to relief, starting with sound therapy. The goal here isn't to silence the tinnitus, but to make it less noticeable. This involves using neutral, background sounds to mask the internal ringing or buzzing. You can use a white noise machine, a fan, or specialized apps on your phone. For many, this provides immediate relief, especially in quiet environments where tinnitus is most prominent. A more advanced approach is tinnitus retraining therapy, which combines sound generators with counseling to help your brain learn to ignore the tinnitus signal over time. Next, let's talk about the power of your mind. Therapies like cognitive behavioral therapy, or CBT, are incredibly effective. CBT helps you change your emotional reaction to the tinnitus. Instead of spiraling into frustration, you learn techniques to break the cycle of negative thoughts and reduce the stress and anxiety it causes. Mindfulness practices can also help you acknowledge the sound without letting it dominate your attention, effectively turning down its emotional volume. Medical interventions are also key. The first step is always a thorough evaluation by an ENT specialist to identify any treatable underlying causes. If you have hearing loss, hearing aids can be transformative. By amplifying external sounds, they not only help you hear better, but also mask the tinnitus, providing two benefits in one. Finally, simple lifestyle changes can make a huge difference. Protect your hearing by using earplugs in loud environments. Manage your stress through exercise, yoga, or hobbies you enjoy. Some people find that reducing their intake of stimulants like caffeine and salt can also help lessen the intensity of their tinnitus. Living with tinnitus can be challenging, but you have the power to manage it. By exploring these options and working with healthcare professionals, you can find the combination of strategies that works for you and significantly improve your quality of life. For more updates and expert advice on managing your ear, nose, and throat health, like and subscribe to ENT Simplified.